Okay, and Dustin, if we could just keep it open, the WebEx open for just a bit. I think we are waiting on a few additional media members. We are going to go ahead and get started today. Good afternoon. I'm Christine Myron. I'm the Public Information Officer here at Central District Health. We appreciate you joining today's media availability on the COVID-19 vaccine within our jurisdiction of Ada, Boise, Elmore, and Valley counties. We are streaming today's session live on our YouTube channel for public viewing, and it'll be recorded and posted on our YouTube account after today's session ends. As part of today's media availability, we have joining us CDH's District Director, Russ Duke, and Program Manager, Gina Pannell, both who are working very closely on vaccine distribution efforts as part of our vaccine delivery team and many other facets of this response. You may also hear today from Natalie Bodine. She is a Program Manager with Central District Health who is leading our vaccine distribution efforts. We are keeping today's session to about 30 minutes. Our panelists will begin with a brief introduction and then we'll roll into your questions. If you have a question, we ask you to raise your hand on WebEx so we can call on you. You'll need to unmute yourself and ask that you give us your name and the organization that you're with. And once you're done with your question, please be sure to lower your hand. So with that, I will turn it over to Russ to get things going. Russ.
Yeah, thank you, Christine. Good afternoon. And thank you for joining us today and for your interest in how COVID-19 vaccine delivery is going within our jurisdiction. This is an exciting point in this response, but it is one that brings some new challenges given the many logistics and unknowns with vaccine allocations to our state and within our 4-county jurisdiction. We're now in week 5 of vaccine delivery in Idaho, and given the significant lift of the process, we're very pleased with how things are going so far. Central District Health has an internal team meeting daily, and we have at least weekly conversations with our healthcare partners who are enrolled as vaccine providers with our long-term care facilities and with the broader community healthcare workforce. Central District Health serves 4 counties, Ada, Boise, Elmore, and Valley, and we want people to remember that in each county across Idaho's health districts, vaccine delivery and getting shots in arms is going to look differently and move at different paces. When one county in our jurisdiction is able to move through subgroups faster, we're allowing that to happen. We're not reallocating those vaccine doses to other counties at this point. So it is very possible that Valley County, for example, may complete Group 1 prior to Ada County. Mondays are one of the 2 data pushes we do on our data website. And last week, we saw COVID case increases in all 4 of our counties. So our disease investigation team has indicated what we're seeing right now and will continue to see over the next few weeks, largely as the effect of holiday gatherings. We want to remind the members of our community that while the vaccine is definitely an exciting and monumental step in the COVID response, we still need to continue to be committed to wearing our mask, limiting gathering sizes, washing hands, staying home when sick, and doing all that we can to keep healthy. I'm going to turn it over to Gina Pannell to share a few more details about our process so far, and then we'll take your questions. Gina?
Thank you, Russ, and good afternoon. Currently, we have 19 enrolled providers that are vaccinators, and they're groups. So it's not just an individual provider. It's maybe a St. Luke's who's got a number of multiple clinics throughout our Treasure Valley and all throughout the 4-county district, as well as 7 providers who are currently in the enrollment process. So originally it was opened up just for a certain number of entities that met eligibility, and we continue to roll those out and expand in the coming weeks. Many of these provider groups have multiple locations that are approved to receive and administer the vaccine, which is critically important. So not all are eligible to be able to give the COVID vaccine. They must be enrolled through the state immunization program and meet very specific criteria that proves they can receive, store, and administer the vaccine, as well as provide their proper reporting back to the state. As Russ had said, this is week 5 of the vaccine delivery to Idaho. We continue to work through group 1 of the state-approved vaccine plan, and we're working to vaccinate subgroups 1 through 4 of the 7 sub-priority groups, which encompass healthcare workers and residents of long-term care facilities. Each week, usually on Thursdays, CDH receives its allocation numbers from the state for our jurisdiction for the upcoming week. For instance, this week we were allocated 4,200 doses of the Moderna vaccine and 1 tray, which is 975 doses of the Pfizer vaccine. We review our enrolled provider list and work with these providers on how they are moving through their internal vaccine plans, and then match with the state plan, and then what quantities they will need for the week. We submit this order to the state immunization program, and that vaccine is shipped directly to the enrolled providers. We're in regular communication with those enrolled providers with weekly calls and touch bases, several of which have moved through vaccinating their own staff and are now offering vaccine to community healthcare workers that are in need of the vaccine. One of the other things CDH is doing is serving to be the bridge for the community healthcare workers who are not employed or enrolled as vaccine providers, to connect them with one of those individuals or provider groups in the community. We encourage any healthcare workers in the community who are in need of their vaccine to call our call center, which is open Monday through Friday from 8:30 to 4:30 with the number 208-321-2222, and we will get them connected with an enrolled vaccine provider. And with that summary, I'll turn it back over to you, Christine.
Great. Thank you, Russ and Gina. Okay, so we will open it up to your questions, just reminding you to please raise your hand. You'll need to unmute yourself when you're called on. And if you would, share your name and which media outlet you're with. I know some folks are joining us maybe with somebody else's name in some situations, but we can open it up to your questions. So go ahead. Let's see. I see Audrey Dutton with a hand raised. Audrey, please go ahead.
Hi, this is Audrey Dutton from the Idaho Statesman. We are curious what's going on with the Pfizer vaccine allowance, why it started at $48.75 and has been kind of stuck at $9.75, and then last week was at $0. Do you have any indication on whether that's going to go up?
That's a great question. I think, Russ, if that's okay, Natalie, if you're online, I would defer this one to you if you're okay with that.
Thanks, Gina. Yeah, this is Natalie with the Preparedness Program at Central District Health. We do anticipate that we will continue to see doses of the Pfizer vaccine allocated to Idaho, which would then be allocated to each of our public health districts to be sent out into our communities. We don't know what the decrease looks like, and don't believe our state partners know as well. They would have to direct that question that way. But at least from where we are sitting, and we did receive, as Gina had stated, doses of the Pfizer vaccine for week 5 allocation. So we do anticipate that we will continue to see that.
Okay, great. Thank you. Thomas Plank.
Hi, this is Thomas Plank with the Idaho Press. I'm interested in your guys' efficiency rates for vaccine doses. I know that there have been 28,000 provided so far. Have you given all of those out? How many are left in reserve? And I mean, what kind of speed are you guys looking at? This is, it's important to get these out as fast as possible, but it's a little unclear at times how that is actually progressing. Thank you.
Yeah, Thomas, this is Russ. And so far we've had administered in our district about 13,000 doses. So like you say, when you look at 8,000, that includes this week's allocation, which hasn't arrived, and certainly last week's allocation, which would still be in the process of being administered. So the tool we're using to monitor that is actually through the immunization reminder information system, and that information is published on the state website. So that's the best visual we have, but we're not concerned at this point in time as far as any inefficiencies that are occurring. We're getting the vaccine out as quickly as it arrives, allocating it to the providers who have signed up, and then, as I think Gina described earlier, we're matching the community healthcare providers and others who are eligible now for the vaccine with those who have it. So we're not seeing any problems at this point in time with the delivery. It's just more a matter of the quantities that Idaho's receiving and that we're receiving that's slowing us down a bit.
Okay, and I'm not seeing any additional hands. So if anyone has a question, please. Oh, there we have, I see Rachel. Rachel, please go ahead.
Hi, this is Rachel Cohen with Boise State Public Radio. I saw the press release from St. Luke's today about how they're opening up vaccinations to healthcare workers that are not employed by St. Luke's. I was just wondering if you could put that in context a bit. How does the health district work with big providers like St. Luke's, and what does it mean that we're at this phase now? Have they moved through 1.1 through 1.4 of their own staff? Have they moved through their entire staff and now they're eligible to provide vaccines to the community? How does that work?
Yeah, Rachel, this is Russ. So that's a great question. So as you know, they're very large. They are the largest healthcare provider in our state. So their initial focus was their own staff, frontline healthcare workers. And where they are at now is they have the ability to help serve the broader healthcare community. So with 1.4, we're looking at outpatient and inpatient medical staff who weren't part of their system. So that's where we're able to match them with other providers in the community who aren't delivering vaccines at this point in time. So that's essentially the stage they're in, is they're ready to start vaccinating the broader community, and they won't be treated really any different than the other vaccine providers we have, like Primary Health Medical Group or Family Medicine Residency, where we maintain a list and we then connect them to the vaccine providers that have the vaccine available and ready to administer.
All right, thank you, Russ. Shira, you're next. Please go ahead.
Can you hear me? Perfect. Hi, Shira from KTVD. So, from a health district point of view, I guess when it comes to the vaccine, where do we stand? And I guess what do you foresee moving forward?
Yeah, hi, Shira. Shira, it's Russ again. So, as far as the vaccine, I think that's ultimately the solution that we definitely needed to move beyond the pandemic. As far as the status we were in, was we relied on behaviors, social distancing, mask wearing to try to keep the disease in check. So now we have to continue that, but now we have a medication, a treatment to prevent people from getting the infection. Now, again, we're in the very early phases when you look at our district of having to vaccinate 520,000 people. And of course, that assumes everyone got the vaccine, and we know that's not going to be the case. So I guess I feel like as additional vaccine is allocated to our district, and as we get it administered to the population that wants the vaccine, that's really our way back to a more normal life that we all enjoy.
Thank you, Russ. Thomas Plank, I see that you have your hand up. I don't know if that was from your previous question or if you have an additional one.
I had an additional one, if that's all right.
Go ahead.
Russ, I'm wondering if you in particular are looking to discuss any new potential rules with the health district board. I know that you guys have shifted to monthly meetings only, so things are going to look a little bit different, but I'm wondering if you are going to advise them on how to get people to get their vaccine. I know that there's a lot of discomfort with that, but the health board's one of the groups that's actually, people listen to them depending on the situation. But I was wondering if you guys are looking at any specific changes, rules, presses, something like that. Thanks.
Yeah, Thomas, Russ. Yeah, so we are, it's an interesting time to be in public health, where we've been at this for about 10 months. And as I noted earlier, our focus had been really on how do we improve and somewhat control and manage behaviors in our community, to continuing to do that. But now our focus is also on vaccinations. So there'll be opportunities at each of our board meetings. And as you noted, we're going to not meet on a weekly basis like we had, but meet monthly, starting here on the 15th of January, this coming Friday. And there'll be discussions about both what's happening from cases and impact to the hospitals, as well as vaccine discussions. So there'll be opportunities at those meetings to have the conversations, and for the board members to encourage the public to get vaccinated. And then we also have our public information team here with us today, and we'll continue to push those messages out both through the traditional media as well as social media and on our website. So we're fully engaged with getting the message out and encouraging people to get vaccinated.
Thank you, Russ. Erica Lee, you're next. Please go ahead.
Hi, I'm Erica Lee from KBOI. I just have a question about in the case that someone in the group one declines the vaccine or decides not to take it, what do you guys do with that to make sure it doesn't go to waste? Do you guys just go to the next subgroup, 1.1, 1.2? How do you guys kind of like keep track of that? And since you guys have been kind of working on this for a couple of weeks now, it's been rolling out for a couple of weeks now, is everything going according to plan? Is there something that hasn't really been going as well as you thought? Anything you want to share about that?
Yeah, Erica. So on the vaccine, like I said, they're connected to they being the population that we're working with. For example, an outpatient medical clinic that's not providing vaccines, they would be connected to a provider who is providing the vaccine. And right now, the demand far exceeds the supply. So we're reasonably confident that vaccine wastage will be minimized, because there's a window of time that it has to be administered, but it's a long enough window. We can get somebody else in line connected with that vaccine provider whenever there's, like you said, maybe an individual decides not to get it, or a group of individuals decides not to get it. So I think so far it's working really well. From my perspective, the biggest challenge we have is getting the vaccine. You know, some of the initial projections were far greater than what we're seeing, and from what we're hearing from our state partners, and they're the ones who get the information from the federal government, that we're not likely to see much in the way of increases in vaccine quantities being delivered to Idaho, at least in the next week or two. But we're hopeful that will ramp up soon, and we'll be able to get a lot more people vaccinated. That's the goal.
Thank you, Russ. I think I saw Audrey Dutton with a hand up again, or maybe it's back down. Did you have a question, Audrey?
Yeah, I think you might have answered it. I was going to ask, what is something that could happen that could speed this up? And it sounds like what could happen that could speed it up is you get more doses. Is that right? Or is there something else that could be done?
No, Audrey, that's really it. We have a lot of providers out there who are ready and willing to give the vaccine. In fact, they are, but the bottleneck right now is the supply chain coming to our state.
Thank you. I see Frankie with a hand up. Frankie, go ahead.
Hi, yeah, Frankie Catafyas here with KIVI. My question is, from my understanding, there is the one subgroup, or there's the one group, and then 1 through 4 of the subgroups are now cleared to receive these vaccines or have been offered, but there's still 5 through 7. When will those groups be offered or allowed at that next phase to receive the vaccines?
Yeah, this is Gina. Thank you for the question. I think we look to our state partners in helping track that information. But when we as a health district receive the numbers of individuals and then allot those to a vaccinating provider, we're tracking those allotted doses. So as we look to the anticipated number that we think will be in that subgroup and we move closer towards that, then we move through the additional subgroups. I understand that in the phased plan, you have a full phase 1 group, and the intent is to get closer to 70% through the way through that group so that you can start planning for the phase 2. The key question is, how do you know when you're at 70%? With the estimated numbers that we're looking at, which can vary, we're looking at using that number that the state did provide for us. They used, licensed number of beds for long-term care facilities. They did a capacity assessment for the healthcare providers. So, it is an estimate at that point, and we use the number of doses that we receive based on that estimate. And as we move through that, we'll begin planning for those additional subgroups through the process right now through the call center, so they can call any healthcare provider or anyone else in the 1.1 through 1.4 can call and get their information. And as we have more of that information available to us, then we can get through those additional subgroups and continue through that process as doses come into the state.
Thank you, Gina. I am not currently seeing any hands raised. Is there anyone on the call that has a question? Okay, I know WebEx time is very slow and painful sometimes. I just wanted to give people an opportunity if they did in fact have a final question that they wanted to bring forward. Okay, I do see Audrey again.
Yeah, thanks. So I just want to make sure I'm understanding this correctly. So I have I've talked with a nurse who isn't affiliated, actually doesn't work for a medical provider, but does go into hospitals, and has contacted I think CDH as well as vaccine providers, and still hasn't been able to get any firm kind of appointment, hasn't been able to get a firm timeline on when they will receive their vaccine. Is the situation that we just don't have enough, and so people are basically on like a long-term wait list? Or like how can we explain why that's happening?
Yeah, Audrey, so we do have a list. I guess we could call it a wait list because there's, again, far more demand than what we have as far as the supply goes. But once a person is on that wait list, we can't tell them exactly when the vaccine, but they will be contacted by one of the providers that we work very closely with. That's who we're giving the vaccine to. When it's allocated to our district, we're pushing it all out to community providers, and they'll follow up with the individuals. So we give the names of the individuals or provider groups, whoever the contact is, to a vaccine provider. The vaccine provider will then contact them. But like I said, it's really impossible to predict, well, it'll be next Tuesday or next Wednesday, because as you can see from the vaccine supply, it's not coming in at the rate we had hoped. And we're not sure, we know what we're getting this week, but we don't know exactly what we'll be getting next week.
All right, thank you very much.
I guess I would just add, I understand people that really want to get it. It's awesome that we have such high interest, but I just emphasize patience. There's just simply not enough vaccine right at this time. And as long as you've contacted us, the 321-2222, the call center, and you're on a list, you will be contacted.
Okay. No new hands are raised, so I'm thinking that may conclude today's media availability. I'll give it just another couple seconds in case somebody has a question that's lingering. Frankie, your hand is still up. I don't know if that's from your previous question.
Yep, definitely from the previous question.
Okay.
Sorry about
Very
that.
good. Very good. No worries. Thank you. Okay, so we just want to remind people that they can go to our website, they can sign up to receive vaccine-related information and updates from Central District Health on vaccine. That website is cdh.idaho.gov/COVID-vaccine. And you can find us on Facebook, Twitter, and Instagram at CDH Idaho. That concludes today's media briefing. Thank you for being a part of it.